Hello, everyone, and welcome to Benefits Planning in the New Year. Thank you all for joining us today. I am Brandy Solomon, and I work for the University of Rochester's UCED, which is the University Center for Excellence in Developmental Disabilities. And we are one of three UCEDs across New York State. In Rochester, New York, we are known as the Strong Center for Developmental Disabilities, SCDD, and our mission is to promote best practice and inclusion with and for people with intellectual and developmental disabilities in our community. As the SCDD Employment Project Coordinator, I am very excited to have Lisa Brown and Lindsay Murphy here today to present on benefit planning. My next is hidden. I'm trying to find my next. There we go. All right. So our webinar schedule is going to look like this right now. We're doing introductions. Some of that Zoom housekeeping is that your chat feature isn't enabled. However, we do have a Q&A button. So at the bottom of your screen, possibly, you will be able to see that you can also enable your captions, your CC, closed captions, and select your language. We will be providing information throughout the webinar that may answer many of your questions live or in the chat. However, if you do have any question, you can go ahead and put it in the Q&A. Hit that Q&A button, typically found at the bottom of your screen as well. And questions can be anonymous if you like, and will only be visible to hosts and panelists. As a reminder, this is a benefit planning in the new year general presentation of information, and there will be information shared about how you can connect with folks to get more detailed about your own individualized situation. So our panelists, Lisa Brown is from the New York Employment Service System. She is the assistant director there and regularly provides presentations on a number of employment-related topics. Lisa provides technical assistance to the NYESS system providers and interacts with Social Security Administration beneficiaries and is a resource for all things related to employment. Lisa Murphy is joining us. She works for Rochester Works as a disability resource coordinator and has experience with managing a supported employment program under Access VR and working with people of all abilities. As a disability resource coordinator, Lindsay works to ensure accessibility to every job seeker, connecting individuals with disabilities to employment resources. So again, thank you all for joining us today. If you do have any questions, feel free to use that Q&A button. Many of them may be answered with live during the presentation or within the chat, and we will send out questions and answers as a part of the follow-up to the presentation as well. At 8 o'clock, we will open for questions completely after the presentations are all done. Thank you. Lisa, are you ready?
I am. Okay. Okay, thank you for joining us tonight. Hopefully, Brandy, you can see my screen, correct?
Yes, good to go.
Okay, thank you. Okay. Tonight we want to talk about benefits, and we're going to talk about benefits in general, and then we'll give you some specific information. So let's get started. We'll talk about NICE. That's where I work. It's called the New York Employment Services System. And I'd like to give you some information about what we can do as far as helping you talk about benefits or get information that you need about benefits or going to work. We're also going to talk about employment and why it's a good idea for people to go to work. We'll talk about benefits advisement, which is an integral piece. If you're on benefits at all, everyone should have access to benefits advisement. And a little plug for Lindsay. She is a benefits advisement, certified benefits advisement counselor. So it's a great idea to connect with her. We also want to talk about some employment myths and facts and Social Security benefits and specific work incentives that go along with those benefits. We'll talk a little bit about ABLE accounts and past plans, which are ways that you can save some money and help you stay on your benefits as well. We'll talk just for a few minutes about Ticket to Work, and then I'll also provide some resources at the end. So to jump right in, if we talk about the New York Employment Services System, it's pronounced NICE. And we are a state partner with all of these state agencies on this slide. Primarily, we work with the New York State Department of Labor. And a long time ago, Department of Labor and Office of Mental Health came together and recognized that there was a lack of resources for employment services or employment-related information across the state of New York. And so because of that, NICE was born. The New York Employment Services System was established to help various statewide entities get information about employment and benefits and resources. So we are a statewide partnership. We're also a collaborative employment services case management system. We have a data system that we can put information in about individuals who are employed or getting a job. We also are a Ticket to Work administrative employment network and one of the largest across the country. And we are a primary employment services data source. But our primary focus is still being a resource for all things related to employment. So as we go through this process tonight, if you have any questions about going to work, finding an employment network to help you get a job, or anything about benefits, please feel free to reach out. And talking about going to work, we want to just talk about the positive things about employment. So, we all have bad days at work, things happen, and we are frustrated, but there are some really good reasons for people to search out employment. And a couple of things that just pop out are that research has shown that going to work is actually a social determinant of your health. So if you go to work, it improves your financial picture. It can also improve your physical and mental health. It also helps with socialization, meeting people out in the community, working with coworkers, gives individuals a meaningful activity, an improved self-worth, and a work ethic. And overall, research finds that it's just an improved quality of life if a person is employed. And it also has been shown to reduce the need for interventions. So mental health interventions, physical interventions, it reduces the need for those interventions because we have social supports already built into our employment networks, our employment situations. So if you're planning to go to work and you're on benefits, there's a couple of really important things to know. It's still a good idea to go to work, even if you're getting public benefits like Social Security benefits or even SNAP and like food stamps or other benefits available. And you don't have to be a benefits expert, but there are a couple of things that you should understand when you go to work. Individuals will have more money in their pocket, and they won't be penalized for working while they receive Social Security benefits, but they must report their income monthly. So if you are working and you're receiving Social Security, you must report your wages from the previous month every month. This reduces the possibility of overpayments that could occur or any other penalties. But it's also really important to consult a benefit advisor that can help you navigate those processes. So if you do get an overpayment, I would reach out to a certified benefits advisor and ask them for assistance in navigating that process. And there are a lot of common frustrations associated with public benefits. And likely that's because every social service agency out there has different eligibility criteria. They have different rules. And so it's hard to keep all of those things straight. And if you do have a certified benefits advisor that can help you, they can help you also navigate the different social service benefits that you might be receiving. And then there are some common myths about what happens when people go to work and they're on benefits. And so we need to make sure that we include them in our employment conversations because we want you to know the truth, what's really going to happen versus just perpetuating the myths. So we'll take a look at some of those myths in a few minutes. In addition, it's important to know some basics about benefits. So SSI and SSDI are both Social Security disability benefits, but they are different types and they calculate wages in different ways. But in either case, working is still a good idea. And it's my little commercial. Please consult a benefits advisor if you happen to be on benefits. One of the concerns is that you might lose your health care benefits if you go to work and you earn too much money. What happens to your health care? And so I want to make sure that you know about the 1619B process through the Social Security Act and Medicaid buy-in for working people with disabilities. And we'll talk about those two programs in a few slides. In addition, there is an opportunity for you to save money even if you are on benefits. And if you save more than the allowable resource limits, these options will not count against your SSI benefits or your SSDI benefits. So we have the Achieving a Better Life Experience, which is an ABLE account, and then a Plan to Achieve Self-Support, which is a PASS plan. And we'll talk about both of those as well. So back to my commercial, benefits advisement. It's a really good idea that anybody who gets SSI or SSDI benefits, that they connect with a certified benefits advisor. And if you are in that situation, but you don't know who to reach out to, please feel free to reach out to NICE and I can help you find one. We have a statewide directory and a locator map on our website that you can put in your zip code, and that will tell you which benefits advisors are close to where you are or where you live. In addition, it's really important for you to have a website that you can go to and learn all about benefits. And if you don't have a website that you can rely on, I want to share that we have a nice customer resource page on our website that goes through various benefit types and eligibility criteria and how they work. In addition, if you are interested in Ticket to Work, there is the choosework.ssa.gov. And that is the official website for our Ticket to Work program through Social Security. And we'll talk a little bit more about Ticket to Work toward the end of the presentation. So now we know that going to work or getting a job is a good idea, even if you are on benefits. But let's talk about some of the concerns. Sometimes people have concerns about going to work because they think they might lose their benefits if they do that. So let's talk about some of these myths. Traditionally, it takes a long time to get Social Security and other benefits. So sometimes people are anxious about going to work because they don't want to lose those benefits. And sometimes family and friends hear stories about different rumors about different people who've gone to work and they've lost their benefits and it's been a big problem. And sometimes they're not as encouraging to individuals about going to work. So we want to talk about what those myths are and hopefully help you feel better about what going to work can look like for you. And again, I want to offer, if you have any questions, please feel free to reach out. One of the first myths that we hear all the time is that I can only work 20 hours per week if I want to keep my benefits. And there are several variables involved in being able to keep your Social Security benefits while you're going to work. And it's not really all about the number of hours that you work. So that is one factor, yes. But other variables include the benefit type that you're receiving. So it makes a difference if you're getting SSI or SSDI. Also, hourly wages make an important distinction about maintaining your benefits. And then there are several work incentives. So Social Security put together some work incentives for people who are on benefits to help them um, try going to work and seeing if that helps, if they can be successfully employed, and providing those work incentives to help them do that very thing. So all of those things are variables. And if you're eligible for any work incentives, that could mean that you can hang on to your benefit longer than you would otherwise without them. So again, a certified benefits advisor can provide clarity for your specific situation. So if you are into this situation, you want to go to work, but you're concerned about the hours, I would seek out a benefits advisor to help you figure that out. Another myth that we hear is I have a disability, so I can't go to work. And I just wanted to mention that Social Security recognizes that individuals who receive disability benefits, they actually can work and have created the Ticket to Work program to encourage individuals to go to work and gain financial self-sufficiency. So a person can be eligible for the Ticket to Work program if they are receiving SSI and or SSDI benefits, and they're between the ages of 18 and 64, and they want to go to work. And this is a voluntary program. So if you are on disability benefits and you do not want to be in Ticket to Work, it's okay. It will not impact your benefits at all. You don't have to worry about being in the Ticket to Work program. If you are in the Ticket to Work program, you are exempt from having that continuing disability review every couple of years, but it's not required for you to be in the ticket program. Another myth that comes up a lot is I can't work until I'm considered stable by my psychiatrist. And this is a myth that individuals have to be considered ready or stable or even compliant with medications or other services before they can go to work. And that is just not true. So it's really important to know that supports are available and they can be created within a workplace to help a person maintain or obtain employment, even if they're managing barriers to employment. So there's all kinds of barriers out there in the world. And even if you're managing those barriers, you can still work with the correct supports within the workplace. So some of the barriers include mental health symptoms or housing or transportation needs or even educational needs. Individuals who are homeless can still obtain and maintain employment with the right supports. So that's important to know, is that when you're working with someone to help you get a job and you get in a job, you're employed, building those natural supports within the workplace environment is going to be really important to help you maintain that employment. And one of the most major myths out there is if I go to work, I'm going to lose my health care. And people are very concerned about that because it's a critical part of our lives. Maybe if you're on SSI benefits, you're receiving Medicaid benefits. And if you're getting Medicaid benefits, it's really important for you to maintain that benefit because they pay for the things that you need. And if you go to work, you might be concerned that you might lose those benefits. And so that keeps a lot of people from going to work. And so we want to talk about how it's important for you to know that you could still receive Medicaid coverage if you go to work. There are ways to do that. So one is called the Medicaid 1619B rule. And it's a special act through the Social Security Act to help people maintain their health care coverage, even if they earn more money than is allowed. The others the other one is called the Medicaid buy-in for working people with disabilities. And we're going to talk about that in much more detail as well. But that is another benefit type that you can get that maintains your Medicaid coverage, and it allows you to work and earn so much more money than you would have originally been able to on regular Medicaid. In addition, those of you that might be on SSDI benefits, you might have Medicare coverage. And there are ways for you to maintain Medicare coverage as well as we go through this process. So let's jump right into that. So 1619B is that special Medicaid rule that allows an individual to maintain their Medicaid coverage even if their earnings become too high for an SSI cash benefit. So let's say you go to work and you're earning so much money at work that you no longer get your benefit check from Social Security. But you may also be able to maintain your Medicaid coverage through a program called 1619B. And this is an automatic process that Social Security manages. As soon as they see that your income is increasing and you're going to lose your benefit, they can roll it over into the 1619B as an automatic process. We do have a template letter on our website, and the link is here for that. But that just gives like a heads up to Social Security. Hey, I just want you to know that I'm earning more money and I might be eligible for 1619B. And then that gives them a heads up to make that switch, that automatic process change, so that you are covered under Medicaid 1619B. There are some eligibility requirements for this program. One is that you're eligible for SSI cash benefits for at least 1 month, that you would be eligible for SSI except for your earnings. So your earnings are too high. And then you still must meet the disability definition by Social Security. And you must meet all of the other eligibility rules, including the resources test or the asset limits. And you need Medicaid in order to go to work. So you have to go to work and you need your healthcare coverage to cover your medications, co-payments to the doctor's appointment. Maybe you need personal attendant care, but you have to have those services in order to go to work. And then the last eligibility requirement is that you have gross earned income that is insufficient to replace SSI or Medicaid. So maybe you're going to work and you're making a lot more money than you were before, but you still can't really afford like the employer healthcare plan. And so you have enough gross earned income, but it's not sufficient to replace SSI or Medicaid benefits. So you may be eligible for 1619B, and that is a great program. And again, it's automatic. There's nothing that you need to do, although you could use the template letter to alert Social Security that it might be happening. The next program is called Medicaid Buy-in for Working People with Disabilities. Now, I just wanted to stress something on this page. This is a slide from 2024. So in 2024, an individual could have gross income as high as $73,932 and still keep their Medicaid coverage. And you also can have non-exempt resources that don't exceed the resource level of $30,000. So, with regular Medicaid, you can only have $2,000 in your checkbook, right? Or your savings account. So Medicaid buy-in for working people with disabilities allows you to earn much more money, and it allows you to have higher resource levels. Now, as I mentioned, this is a 2024 slide. So this is something that is fading out, and we're moving to the 2025. Let me just say a couple things. On this slide at the bottom, it talks about the link to the Medicaid buy-in toolkit. And so the toolkit is currently being updated because the 2025 limits are changing and they're drastically increasing. So it's terrific news. But the toolkit is not quite available yet. And I also wanted to mention that right now, this is free. There is no, you're not buying into it, so you don't have to pay a premium. But in 2025, this is going to change just a little bit. So what is anticipated to change is that there's no longer going to be an upper age limit. Right now, the limit is age 65, and then you're no longer eligible for it. But it can extend past the age of 65. There's no limit. In addition, the asset limit is going to be expanded to $300,000. So like with regular Medicaid, you can have $2,000 in your savings account. If you are participating in the Medicaid buy-in program in 2025, that asset limit's going up to $300,000. In addition, the income limit is astronomical. It could be up to $320,000 annually and still keep your Medicaid coverage. Now, a couple things I mentioned already, the toolkit is being updated right now. Once it's completely updated and the Medicaid and Medicare agency in New York approves all of the changes, this is what will happen. These changes will take place. So it's in process right now, but we anticipate that sometime this year, these are the changes that will take place. So as with Medicaid 1619B, it was automatic. This Medicaid program is not automatic. You actually have to go to your local office, disability services office, and apply for this benefit type. But it is huge. It can be extraordinary for people to be able to work and earn a lot of money and still keep their Medicaid coverage. And sometimes people say, well, why would I need that Medicaid coverage if I'm earning $300,000 a year? But sometimes people rely on services that other insurance won't cover, like maybe a personal attendant going to work. Maybe the employer healthcare insurance is not going to cover that. And so you need your Medicaid coverage because that does cover at least a portion of that. And so it's important for people to be able to know that they can keep their Medicaid coverage and all of the services that they've had or needed in the past, even with the Medicaid buy-in for working people with disabilities. Another thing to mention about this is that initially, like in 24, there was no buy-in. Like there wasn't a premium that you had to pay. But if the income limit is over $300,000, there may be a premium based on the wages that you're earning. So that has yet to be determined. We don't have an answer for that yet. But that is something that may be anticipated. If you're earning $300,000, you may have to pay a premium. Anyway, this is a terrific, terrific program. Sorry, I can talk on it all day long. In addition, Medicare coverage. So most individuals who receive Social Security disability insurance also are eligible for Medicare coverage. And there are some ways for you to be able to maintain Medicare coverage if you go to work. So following the trial work period, individuals can continue to receive at least 93 months of Medicare coverage, and that's 7 years and 9 months. So that is a long time. If that person has hospital insurance, which is Part A, they can receive that premium free. In addition, if the person is already enrolled in the supplemental medical insurance, which is Part B, and the prescription drug coverage, which is Part D, then they can also have those premium free. But if they have not signed up for Part B or Part D, then there will be a penalty if that person wants to enroll after that period of time. And I mean, penalty meaning that there will be a premium for those. And then after this premium-free medical care, Medicare coverage ends due to work, you can still buy continued Medicare coverage as long as you remain disabled. Excuse me. So losing your healthcare coverage is a concern about going to work and the possibility of losing coverage, but there are ways already developed for you to maintain this healthcare coverage. So another thing I would suggest at this point is if you are in this scenario where you want to go to work and you have benefits and you need your health care, follow up with a benefits advisor who can help walk you through this process and how this works. So let's turn our attention to other benefits like Social Security, SSI and SSDI benefits, and the work incentives that go along with each of those benefit types. So this section describes the basic information about each benefit type and some of the specific work incentives associated with benefit types. So again, here's my commercial. Please reach out to your certified benefits advisor to get the answers to your specific questions regarding your specific situation. We're going to start with SSI, and that stands for Supplemental Security Income. So the SSI program provides a cash benefit payment to people who have limited income and limited resources. So the resource limits in 2025 are $2,000 for a single individual and $3,000 for an individual with a spouse. Unfortunately, that resource limit has not changed in years. So that's still a requirement that it's $2,000. So that means anything that can be converted into cash counts as at that limit. It does not include the house if you own a home or a car if you own a vehicle, but it could include the money you have in your savings account or a retirement fund, or even like child support payments. If it happens to be over a certain amount and it all adds up. If it goes over $2,000, then you have reached that limit, gone over the limit, and possibly have lost your SSI benefit. So it's really important if you're maintaining SSI that you stay underneath that resource limit. Social Security also when they're thinking about giving you SSI benefits, they start with what's called the federal benefit rate. And in 2025, that number is $967. So they start with that amount, and then they consider any unearned income that you have, like child support payments, and any earned income that you have, which would include any money that you get from wages when you go to work. And then it also considers any work incentives. So remember I said work incentives were given by Social Security to help you practice going to work to see if that's a good thing for you to do, and makes you or helps you maintain that benefit longer if they weren't available. So it helps you try working to see if that will work for you. So a thing to remember is that these rates can change every year. So as I said, the resource limits have not changed, but I hope they will in future years. And the benefit rate does change every year. So that's something to keep an eye on. And then there are several work incentives that are associated with SSI benefits. And we're going to talk about a few of them here tonight. We're going to talk about the student earned income, and it's called the student earned income exclusion. We'll talk about the impairment related work expense, or an IRWE, and a blind work expense, and then subsidy or special conditions. So the student earned income exclusion is specifically for people who are under the age of 22. So it's a great benefit and it helps a lot of people, but the problem is it's just for people who are under the age of 22. The other part of this is that the individual must be going to school, either part-time or full-time, and working, again, either part-time or full-time. But if those things are met, then it helps that person exclude some of their earnings from their income, their wages from their job, when Social Security calculates their benefit check. So in 2025, and this changes every year as well, the amount that can be excluded is $2,350 per month, up to an annual maximum of $9,460. So what that means is let's say there's a 19-year-old person who's going to school and working, and they earn $1,000 in 1 month. Then he contacts Social Security and says, hey, I would like to use the student earned income exclusion for the month of January. And they have to submit their wages, which they should already be doing. And they have to prove that they're going to school. And then Social Security will subtract that $1,000 when they're calculating the Social Security benefit check. And they can do that for up to $2,350 per month. So if an individual is earning $2,350 in a month, it will be almost like they're not earning any of that when they calculate the benefit check. So they'll get the full wage of $2,350 and they'll get their full benefit check of $967. So that saves that individual a lot of money. They can still get their benefit check and they can still get their wages. If that person earns more than that $2,350 in 1 month, they can only exclude that maximum of $2,350. Every year, there's a calendar adjust. So what that means is at the end of 2025, it starts over. You can use, if you've used the maximum in 2025 for the year, then in the next year, 2026, that will start over. There will be a new maximum for that new year, and you can use it in that year. So as I said, it's a great work incentive for people who are both going to school and working, and they're under the age of 22. The next work incentive is called the impairment-related work expense, which is usually called an IRWE. And IRWEs are costs for items or services that a person needs to go to work because of the disability. So it has to be connected to your disability, and the costs are not being reimbursed by anybody else. So Social Security will then deduct the cost of an IRWE from your countable income when determining your eligibility for the benefits. Now, the IRWE has to be approved by Social Security. So I have a link there for an approval request form, and you can write down the name of the expense that you needed and what it was used for and the receipt for that amount. You're going to want to attach that as well. These are some of the examples of things an IRWE would cover. So supported employment services could be attendant care, transportation costs, although there's a specific chart to determine that. It could include prosthetics, work-related equipment, medications like copays, doctor's appointments, and copays for that. A lot of different things you can use an IRWE for. So you would fill out that document, send it to Social Security, they approve it, and then when they're figuring out your SSI for the next month, they're going to be able to remove the IRWE expenses from your countable income. So then you should still be able to maintain your benefit longer, and they'll subtract those expenses from there, so you're not actually losing your as much of your benefit check. This is the IRWE transportation decision chart, and I won't go through the whole thing, but if public transportation is available in the community and you can use it, then it cannot be used as an IRWE expense. But if public transportation is available and you cannot use it for some reason, then the cost of that transportation, a cab or a taxi, could be an IRWE expense, could be counted as an IRWE expense. The next work incentive is called a blind work expense, and it is very similar to the IRWE. They're both costs for items or services that you need in order to go to work, and the costs are not being reimbursed by anybody else. However, the blind work expense does not have to be related to your specific disability. And the costs, again, they do have to be reasonable costs, and that is customarily charged for the covered or similar services or supplies. So it has to be something that is reasonable and customary, and the cost for whatever you need in order to go to work. So some of the examples here, it can include all of the IRWE expenses that we just talked about, But it could also include just things that you need to go to work, like it could include clothing, or it could include lunch expenses, or childcare for a child that you need to cover while you're working. So it can include a lot of different things, and it does not have to be related to your disability. And again, these are the examples from the IRWI, and it can include all of this information as well, including that transportation decision chart. And then the last SSI work incentive that we'll talk about is called a subsidy and special condition. And a subsidy is the extra wages that an employer pays an individual for services over the reasonable value of the actual services performed. So SSA deducts the value of subsidies from earnings when SSA makes an SGA decision. And it's important for you to contact your local Social Security office to let them know that you would like to submit paperwork for a subsidy. Now, it's kind of confusing, but if an individual who is working in the same job as somebody else, but they're not expected to perform at the same level of performance as the other person, that could be considered a subsidy or a special condition. So at the bottom, it says special condition exists when a worker receives support or services from someone other than their employer. So maybe they have a job coach that comes in, and it's potentially subsidizing the worker's ability to perform. So any third party may provide a special condition. So the subsidy is the extra wage a person receives over what they're actually being required to perform. And a special condition is someone who's receiving support or services from someone else other than the employer to help with their performance on the job, like a job coach. And if you would fall into this category, you're working and you're doing a great job, but you might think you have a subsidy or a special condition happening, then there is something called a work activity report, and the employer needs to complete the form explaining and measuring the amount of the subsidy. And so sometimes that is a question. Employers aren't sure about how to complete that. They can contact the Social Security office to get more information, or you can also connect with a certified benefits advisor who can help you figure out how that needs to be reported. So this also is a really great work incentive for people to use. Okay. The next benefit type we're going to talk about is the Social Security Disability Insurance, or SSDI benefits. So Social Security provides cash benefits to individuals who have worked and paid into the SSA insurance program. And there is an eligibility requirement to get there, and that is an average adult has to have 40 work credits. Now, I mentioned that it has to be an average adult, so there are exceptions to this rule depending on an individual's age. So we're not going to go into any of those other conditions, but I just want to stress that the average adult is required to have 40 work credits. And an individual can earn up to 4 work credits per year, and it's based on a quarter. So January, February, and March is the first quarter. And if a person earns $1,810 in that first quarter, they can earn 1 work credit. And so every quarter of the year, they can earn 1 work credit if they earn over that $1,810. So if you do the calculation, it looks like in order to get 40 work credits, and you can only get 4 per year, you have to work 10 years in order to be eligible for SSDI benefits. And then once you're eligible for this benefit, the amount that you receive is actually based on the earnings that you've had over the work years. So it's not really an average of all the earnings you've had, but it is based on the earnings that you've had. And then the specific rates listed here have the potential to change at the start of each new year, so that work credit per quarter, 1,810, is new in 2025. So be sure and take a look at that on an annual basis, that number will change as well. So Social Security disability provides benefits to individuals who have worked and paid into the SSA insurance program. And the amount that you receive is based on your earnings, as I mentioned. And there are several work incentives available for individuals who receive SSDI and they want to go to work. So we already talked about IRWIs, but that is also available for people who are getting SSDI benefits. Then there's also the trial work period, the extended period of eligibility, and the expedited reinstatement. So let's take a look at those. Now, the IRWI we talked about before. Remember, that is for costs for items or services that you need to work because of your disability, and the costs are not reimbursed by others. Social Security will deduct the cost of an IRWI from your countable income when they determine your eligibility for disability benefits. There is an approval form for IRWIs. Again, you have to complete the form, submit it to Social Security, and get their approval. And then they will take that into consideration when they are figuring your disability checks. And these are all the same examples that we had before with SSI benefits. And then the next work incentive is called the trial work period. And this allows you to test your ability to work for at least 9 months without losing your SSDI benefits. You're going to receive the full SSDI cash benefit regardless of how high your earnings might be, as long as you report your work activity and you continue to have a disabling impairment. Your trial work period begins when you earn over $1,160 per month in 2025. And again, that changes every year. So something to think about with the trial work period is that when you get your disability check, SSDI comes in the mail, you get your check. And then Social Security says, okay, Social Security will give you 9 months to try to go to work. And during that period of time, you can earn as much money as you want to, and you'll still get your full benefit check. And so sometimes people say you can earn Bill Gates money. So hopefully you all know who Bill Gates is, but that's a lot of money. So if an individual earns $1,160 in January, and it should say 25, Social Security will count January as that first trial work period month. If that individual income falls below that 1,160, then that month is not going to be counted as one of the trial work months. So a person can work and earn above and earn below that $1,160 for a period of time. But once they hit 9 months, then that trial work period is done. And those trial work period months do not have to be consecutive. So you could be over and under all the way till you've used 9 months. And then it's completely over, that trial work period. What happens next then is another period pops up and it's automatic. It's called the extended period of eligibility. And this is a 36-month period in which you will receive your SSA cash benefit for all months that your earnings are below what they call SGA, which is substantial gainful activity, if you continue to have a disabling impairment. So a couple things I want to say about this. SGA, substantial gainful activity, is a level. It is a wage level, an income level that Social Security made up that says if you're earning this much money, you are earning enough that you don't need our support anymore. And so in 2025, that dollar amount is $1,620. So if you earn over $1,620 during this extended period of eligibility, Social Security is going to start terminating your benefits. And they have 3 months to do that. So the first month is called the cessation month. And then there are 2 grace period months after that. And then your benefit will be terminated. Excuse me. However, something important to remember is that if the individual earns under that SGA level during this extended period of eligibility, they will be able to receive their SSDI check again. So the SGA level, that $1,620, determines whether or not a person will continue to receive their benefit or they will not. So if you are over SGA level, they start the termination of benefits. If you fall under SGA level, then you may be able to get your benefit back during that period of time. And then the last work incentive we want to talk about associated with SSDI is the expedited reinstatement. And this is a safety net for people who have successfully returned to work and their SSDI cash benefits are terminated. So let's say you go to work, you're earning over SGA level, and things are great. You are not receiving benefits anymore, but it's okay because you're earning enough money that you are self-sufficient and happy and everything's great. And then something happens. Maybe the company that you're working for had to lay off people and you got caught up in the layoff situation. And so your SGA, you went below the SGA level and you're continuing to go below the SGA level for a period of time. You can contact Social Security and say, I am below SGA level, and it's still within this 5-year period. So you got your terminated your benefits, and within 5 years this happens. Then you may be able to have your benefits started again right away. So you call Social Security and you ask for an expedited reinstatement of benefits. So Social Security has 6 months to determine whether or not you are going to get your benefit back, whether you're entitled to get your benefit back. But during that time, you can request to get your benefit check while they're thinking about it, while they're doing the review. And that's very helpful for a lot of people. So remember, always request that you're able to get that benefit check while they're doing their review process. At the end of their review, they can say, yes, we think you're entitled to your benefits still, and the benefits checks, the disability checks will just continue, pick up where they left off. They also could say, no, we don't think that you're entitled to your benefit check anymore. And if they say that, there might be a couple of reasons. Maybe the original diagnosis that you had that made you eligible for the benefit check is no longer there. Maybe it got better. Maybe now you have a different disability that has more crucial symptoms. And so they may ask that you apply for disability benefits under your new diagnosis. So that could be a reason why they say no. But it's really helpful to know that this expedited reinstatement is available during this time frame so that you can get your benefit check back while they're doing this review. And then if they say, no, you're not entitled, then you may have to reapply for benefits under a different disability type. Then there are some other, they're kind of work incentives because they are ways for you to be able to save your money and still go to work. And we want to talk about a couple of those. So one is called an ABLE account, and it stands for Achieving a Better Life Experience. And the eligibility requirements are that a person has to have had a disability that was present before the age of 26. Now, I also want to mention that in a few years, that age is going to go up to 45 or 46. And it's not going to change in 25, but it may change in a couple of years. So if you have a disability that was present before the age of 26, you're eligible now for a disability, for an ABLE account. But in a couple of years, it could go up to 46 and you may be eligible at that point. So it's something to keep in mind if you don't qualify under the age limit here. You also have to have one of the following. So classified as blind, as defined by Social Security, entitled to SSI or SSDI because of a disability, have a disability that is included in the Social Security list of what's called compassionate allowance conditions, have a written diagnosis from a licensed physician that documents a medically determinable physical or mental impairment that results in marked and severe functional limitations. So that's a lot of information, right? So it's something to really remember is that if you have a disability before the age of 26, and maybe if you're receiving SSI and SSDI, or you have a disability of some sort that is not necessarily related to you don't have SSI or SSDI for it yet, but you could be eligible for that. So these are some of the conditions for the eligibility requirements. And then what you can use it for is a savings program for eligible people with disabilities who have resources that would make them ineligible for other benefits. So for example, if you receive a $10,000 inheritance from a family member, and then you put that money in a regular savings account, then you would be over the resource limit for SSI and automatically lose your SSI benefits. However, if you put the money in an ABLE account, it will not count toward your resource limit, and you can maintain your SSI benefits. So it's a great benefit for being able to save money and go over that resource limit, and it still won't impact your benefits. The other important thing to know is that you can use an ABLE account to pay for medical and living expenses in order to maintain your health, independence, and quality of life. So at this point, that definition is really broad and could include a lot of different things. You can contribute up to $19,000 annually in 2025 and have up to $100,000 in the account without it impacting your SSI eligibility. So that's really important. One of the things I've heard from a lot of people is that being on disability benefits, they can't save any money for retirement. And if they can't do that, how are they going to retire? So an ABLE account is a great resource to be able to do that. You could save up to $100,000 to be able to put toward a retirement plan if you wanted to. And it's important to know that if you open the account for yourself, for your benefit, other people can contribute to it as well. It's not something that you just have to contribute to, but it can be opened on your benefit by someone else even, and people can add money to it over the years for you if you wanted. So it's a great resource. It is managed by New York ABLE. And so I've put some details here in the back of this PowerPoint so that if you wanted to reach out to New York ABLE to get more information, this is how you could do that. They offer like a regular checking account, a savings account, and then there's an investment option as well. So there's a lot of different things, and it depends on what really meets your needs as what you're looking for, but you could certainly talk to New York ABLE and they could help you figure that out. The next thing we want to talk about is called a PASS plan, and that's called a plan to achieve self-supports. And a PASS plan allows you to set aside money other than your SSI for a specific time period so that you can go to work and achieve your work goals without losing your SSI cash benefit. So sometimes an example would be, I need to get to work and I don't want to ride the bus all the time to work or take the subway. I want to buy a car to go to work. And so you could set up a PASS plan, put money aside each month toward buying a car. And then at the end of the plan, you would take the money out and buy the car and then use it for your goal to drive yourself to work. Now, there are some rules about that. You can set up the PASS plan, but it has to be approved through Social Security. So you would put together the plan. You could do it. Your certified benefits advisor could help you do that. A representative payee or a friend of the family. Anybody can help you put together a PASS plan. But then it goes to Social Security and they have to approve it. Now, it's typically very specific. You can put the terms in there, but it has to be followed. So if you say I'm going to put $50 a month in a PASS plan for 2 years, and then I'm going to take it out and I'm going to buy a car, then that is specifically how it would roll out. You would have 2 years to save money, take it out, and then purchase a car. So they wouldn't necessarily want you to buy something else with it. They may be, or they may allow you to extend it for a period, but it would not be like a long period of time. They might just extend it for a month or two or something like that. However, it goes through the approval process. But it is usually pretty rigid. It's 2 years, $50, and then I'm going to buy a car. Other types of expenses, though, like if a person wants to go to school, and in order to go to school, they need to have a computer in order to do their homework and their school equipment stuff. They could set up a past plan to buy a computer system, and however much time it would take to develop that. And when it's done, then you could go and buy your computer that you need for school. So it's a lot of different things. It's not just a car. It can include childcare. Maybe you need to have a babysitter for your child when you go to work. And so setting up a past plan to save money to pay for that, you could certainly do that as well. So there's a lot of different options with past plans, but again, it is restricted to Social Security approval and pretty specific on the timeframes. So it's something to really consider if you're thinking about putting this together. This is information about past plans, so it's a link to get there if you're interested in learning more about that. So this next section talks a little bit about Ticket to Work. And, we talked a little bit about this earlier, that Social Security has determined that people who are getting SSI and SSDI benefits can work. Just because they have a disability does not mean they can't work. So they put together this Ticket to Work program, and they wanted to help people go to work and be self-sufficient. So self-sufficiency was the goal. And in the long term, they would love it if people would go to work and get off benefits. They would work themselves off benefits. But at this point, the person just has to agree to have a reduction in benefits. So improving, going to work, earning more money, maybe losing a little bit of their Social Security benefit check, and being self-sufficient, being happily employed. Again, it is a voluntary program. So you may have the ability to join Ticket to Work, but you don't have to. And if you decide not to, it will not impact your benefits at all. If you decide to go in the Ticket to Work program, it can help you get ready to go to work, obtain a job, and then maintain that job through employment services that don't have any cost to you. You don't have to pay for those employment services. For the eligibility, again, receiving SSI or SSDI between the ages of 18 and 64, they want to go to work and agree to a reduced reliance on SSA benefits. If you decide to assign your ticket to the employment provider, Social Security will suspend the continuing disability review as long as you are making timely progress. So what is timely progress? Timely progress means that you are going on interviews, maybe you're getting a job, participating in an educational program. You have to be making some progress in the process. The employment provider that you select can assist you in preparing for obtaining and maintaining a job. So again, it's somebody that you want to work with. You can choose the employment provider, and that they require that your provider be in contact with you monthly if you're not employed, or quarterly if you are. So sometimes you're working with a provider agency and they're helping you go to work and they're helping you get a job, and you don't want to be in contact with them all the time. You need some space. You don't want to talk to them every month. But Social Security requires that they are in contact with you monthly or quarterly. So that's another thing that you have to agree to in order to be in the ticket program. If services stop for some reason, your ticket will be unassigned. So what that means is if you never call them back, the provider back, or provider stops providing services for you for some reason, then your ticket is in danger of being unassigned, meaning that you would still then be eligible for that continuing disability review. Your employment provider can offer benefits advisement services so that you can better understand how working will impact your benefits. Now, not every provider across the state will have a certified benefits advisor on staff, but we can connect you with someone if they don't, or you can get a referral from them to a certified benefits advisor. This next section is just a short little section on additional training opportunities. So I just wanted to mention that NICE, which is where I work, we provide trainings at no cost, like the one that we're doing this evening, and they cover a variety of employment-related topics. So many of you are probably aware that New York is now an employment first state, meaning that anybody who says that they are interested in going to work can work. And so we want to help them. If they're interested in doing it, we want to help them get a job. And so we offer an Employment 101 training, anything that you need to know about going to work before you get there, why working is a good idea, the myths and facts we talked about tonight, and how to work successfully while on Social Security benefits. Another training that we offer is something called employment conversations. So talking about appropriate language in the workplace, dress codes, workplace norms, relationships with coworkers and supervisors, and how to develop a good work ethic. So we're really gearing up toward the Employment First initiative in New York and focusing our training on employment and what people need to know about going to work. So if you're interested in any type of training related to employment, please feel free to reach out and we can get something together for that. I have also included some resources. So a couple things that, we've already talked about past plans, but there is information for you to be able to click on it and get frequently asked questions about what it means, how you do one, and what it can involve. The New York ABLE, that's their website, and that's really important to check it out and see what type of account might be most appropriate for you. We also have a document on Social Security myths and facts. So something about understanding the myths and facts about going to work while you're on benefits. We also put together something called a Job Seeker's Guide for Employment. And this is a document that includes a lot of information about going to work and what you need in order to go to work. So if you're working at a business, you have to have an I-9 form, which is a document, it's a work-related document. And in order to do that I-9 form, you have to have certain pieces of identity. And if you don't have those pieces, where can you go to get them? So that's part of that guide for employment. There's also other things in there, websites and resume information and accommodations and all kinds of different things. But feel free to print that out and use it as a guide as you're looking for a job. I also want to mention Social Security work incentive, work incentive network liaisons. So Social Security hires people who are work incentive network liaisons. They're like a certified benefits advisor, but they are contracted by Social Security. So you could contact your local office, your local Social Security office, to get information about who the liaison is within your area. So if you don't have a certified benefits advisor close to you, that would be another option. In addition, I wanted to mention that through the New York State Department of Labor, they have hired people who are called disability resource coordinators, like Lindsay, who's joining us in a few minutes. And they also have hired program managers. So the disability resource coordinators are located in upstate New York, and they are they're certified benefits advisors and provide services to help people get jobs. In the boroughs of New York City, they're called program managers, and there's a couple listed there on the screen, like Carlos and Edna, and they provide benefits advisement for the 5 boroughs in the city. So this is another great resource. Again, if you need assistance finding someone close to you, you can always reach out to me. I can help you with our locator map. There is a list for the upstate New York DRCs, Disability Resource Coordinators, and it's based on the counties that they serve. So that is another great resource for you if you're looking for someone to help you with benefits. And then that is the end of my presentation. My contact information is here, Lisa Brown, and my phone number and my email address, lisa.brown2@omh.ny.gov. I think you'll be getting a copy of this PowerPoint. So if you need that information, please feel free to reach out. Thank you very much.
Thank you very much, Lisa. And we are going to transition to Lindsay Murphy.
Hello, everyone. Hopefully you can see my slides now. So you might have seen I've been trying to answer some questions in the chat. I am a benefits advisor, as Lisa was talking about. So my name is Lindsay Murphy. I am the Disability Resource Coordinator for Monroe County. So I am based out of Rochester Works Career Center. So I'm going to do a little overview of what are career centers, and Lisa had mentioned the link for finding where all of us DRCs, we say for short, where all the DRCs are across the state, and we're typically tied to career centers in some way. So there'll be a list of who the person is and their contact information and potentially what career center they're associated with. But if you are local here in Rochester for Monroe County, Rochester Works is where I'm out of. So let me kind of jump into what is a career center. So we have a variety of services. We're all about employment. So along these same lines of thinking about employment and benefits, there's a lot of other services available out there. So we just wanted to highlight some of those and kind of talk about my connection with the Career Center and what the DRC role does across the state. So our main services at career centers we're helping with all areas of employment. So if you need something like a resume, cover letters, interviewing skills, we have a plethora of workshops that I'm going to talk about. But essentially, you'll meet with a career advisor to sit down and really look at your situation and what are some of your goals for employment, and we'll point you towards some resources and provide that assistance in-house as well to reach those employment goals. So as you can see here, I have some information about locally here at Rochester Works. Career centers can vary across the state, but in general, a lot of these services are available at any of them. So here in Monroe County, we have a free computer lab anybody can come in to use for a job search, free printing and faxing. So if you need to print out a bunch of resumes, go into a job fair, people can come in and do that. We do those one-on-one appointments. So we have people typically come in to register with us as that first step, as getting connected to a career center, American Job Center, one-stop center. There's a lot of different terms out there used for us. But yeah, we will sit down with somebody, kind of identify what they need, provide that advisement. And some of the workshops, as you can see on here, we do workshops, everything from writing a resume to owning your own business. So really kind of spans a great length between, everything in between. So I'll talk in a little bit here about some workshops specific to disability that I do as well. So we also have a training department. So that department's focused on, folks that either try to explore what career options are out there, using some assessment tools to determine what somebody's interests are, maybe where their skills are, for identifying what path to really take for their career. We work off of something called the in-demand occupation list to help with training funds to help people get into different career paths. So we have funding available. We could typically pay up to around $6,000 for training. So Typically, they're focused more on like a shorter term training program, a certification, mainly because that $6,000 isn't going to cover something like a bachelor's program, but we could assist with a portion of that. A lot of times we're working in conjunction with Access VR as well. So if you're familiar with their services and their support for training, we do work in conjunction with them to potentially share costs as well. So yeah, if anybody's interested in training, we typically just have people come in for one of our workshops. It's our training grant workshop, and you can get more information about how to use this funding and the process and meet some of the staff here at our office that would help you through that. Another highlight of career centers across the state is business services. So we have our career center with the career advisors, but then we have other folks that are focused on building connections with employers. So they're not necessarily providing support for the job seekers, but they're offering opportunities for businesses to either come to our site, like here in Monroe County. We hold every Thursday open recruiting events. It's basically like open interviews. Some companies will even offer jobs on the spot. So this business service department, connected with career centers across the state, they're out there building those connections to help bridge the job seekers at the career center and bringing those opportunities from employers to them. So we're helping connect in that way. So locally here, we have our hot job board on our website of rochesterworks.org. And these are all local postings, meaning that we have a connection with those employers. We have vetted them. Sometimes if you're applying online, not quite sure where your information is going to, but these companies we have a direct relationship with. And there are potential for other grant funded opportunities as well. Like, for example, locally here, we have on-the-job training grants as well as work tryout grants. So some of those help with folks that maybe don't have as much experience getting into certain fields. So it can help out the employer financially on that aspect if more training is needed, as well as help people who are already working somewhere but want to increase their skills and kind of move up the ladder with that employer. So a lot of good opportunities through the business service department as well. Career centers also have a connection for youth. So these will vary across the state. Locally here, we have navigator services, which can assist youth up to age 24 that might have some sort of barrier to employment. And those barriers can be a variety of things, but disability can be one of them. So a little bit extra assistance for that, as well as we're known for our summer youth program. I think this last year it was over 500 or 600 students they helped place in summer employment positions. And that has recently expanded into our Rock Your Job program, which is now throughout the school year, so evenings and weekends as well. So even if you're not here, these types of programs might be available in your area as well. Okay, so kind of getting more into my role and what we're doing across the state. So Lisa had mentioned disability resource coordinators and New York SCION earlier. So SCION is standing for Systems Change and Inclusive Opportunities Network. So we're working across the state to build more opportunities for individuals with disabilities to become employed. So working with a variety of people where we serve many functions, and some of those departments I mentioned earlier, we're working with all of those departments as well. So we fit in multiple areas. So I'm just going to put up some of the things that we do, and I'll go through each one here. So I mentioned some of those career advisement meetings at our career center. We're involved in those as well. So like, for example, here locally, if somebody comes into our Rochester Works Career Center and identifies as somebody with a disability, we have staff referring to me, and I can reach out to that person and offer supports when it comes to either accommodations within the Career Center, so to participate in our services, talk about accommodations or disclosure of a disability for an employer, so what kind of their plan is for discussion when it comes to employment. The benefits piece obviously is the reason we're here tonight. A lot of questions about benefits and thinking about work. But yeah, we're working a lot with the job seekers, but we're also on the side of businesses too. So with our business service department, we're providing education to employers and kind of helping to ease the concern maybe some employers would have, or maybe they're just not familiar with working with an employee with a disability. So we'll work on a one-on-one basis for, if somebody does have specific questions. I've had employers reach out to me to say, hey, we just hired or just interviewed somebody who was deaf, and we're not quite sure how do we get interpreters or what's the best way to communicate in this situation. Want to make sure we got all the resources we need, and I was able to connect them to that. So I work again in conjunction with Access VR to provide a lot of these trainings to employers. We do webinars for employers, but we're always looking for more ways to build those connections to, increase the number of opportunities out there for people. We are working under what's called an integrated resource team to help job seekers either get connected to other resources in the community, or if they are connected to other resources, get everybody on the same page when it comes to their employment goals. So sometimes it's confusing if somebody is working with a service coordinator. Maybe they have a therapist, maybe they have an Access VR counselor, then they're connected with the career center. Let's get everybody together. Let's sit down, come up with a plan for what that individual's goals are for employment. If we want to consider training, maybe then we add in a representative from the school, a teacher they're going to have, or an advisor from there. So it's a resource team. It's building that team around the person to make sure that things are moving forward towards their goals of employment. Lisa mentioned the Ticket to Work program before. I'm going to give a little bit of information just locally how that's working here in a couple of slides. And I think probably now would be a good time to talk about those workshops that are disability related. So across the state, we're all doing different types of workshops, but locally here, and actually mine are on Zoom, so you can attend anywhere in the state, and we do have many people attend outside of Monroe County on a regular basis. I've even had people come from other countries that find us because we do post our workshops on Eventbrite. So the workshops I do on a monthly basis are disability and disclosure. So I mentioned earlier about coming up with that plan for identifying how to really approach this topic with an employer. So we start right at the beginning with that workshop. We start, what is the Americans with Disabilities Act? What are your rights as somebody with a disability in the workplace? What are the employer rights? What do they have to accommodate? What do they not have to accommodate? And some resources for identifying what those accommodations might be for you. And if you're not quite sure, where to start with that process. Disability disclosure, then we do increase your income. So increase your income is very similar to what Lisa presented tonight. So it's all about disability benefits. So identifying what benefits you might have and then the impact of work on those benefits and ways that you can work while receiving benefits. Another workshop that I do that's twice a month is Disability Job Search Group. So that one is varying in topics within that. It's less so a presentation, but more of discussion. And really like to just get a group of people. Everybody who joins has a disability of some sort or is a service provider assisting people with disabilities. And we have a topic of the day. So like coming up here, we're going to be talking about disclosure. We also have another one talking about interviewing, both in person and then virtual interviews, which are quite popular now. So how to navigate that whole world. So every month they change out, but I mention all these just because you can, like I said, attend anywhere across the state. Feel free to go on our rochesterworks.org website, and we have a workshop calendar on there, and feel free to sign up for any of those. So my last point on here what the DRCs are doing, while we're helping to coordinate a lot of these other services or bringing in these other providers all at the same table, we're helping the person get connected to the agencies to actually provide those services. Yes, we can assist in-house as well, but what I have a lot of conversations with people about is maybe there are other providers that offer different services than we do that would be beneficial, because we're not going to all duplicate services, right? We want to streamline this and make sure people are getting connected to what would be the best one for them. But it doesn't mean that they would stop, interacting with me. Can be behind the scenes helping to coordinate and attending meetings as well. I think at this point, let me stop. I'm going to switch over to the site that Lisa shared, that you'll get in the slides. I want to show you the New York State Department of Labor site where we are all listed. So let's see if this will work here. Do you see that website? Hopefully. All right.
Yes.
Okay, good. So this is the dol.ny.gov site, and then /New York_Scion. So this is all about what we're doing across the state, some more information on, our funding and how this kind of came about. But on here, not too far down, is that link to click for disability resource coordinators. It'll jump you down to here, and we have a whole list of the DRCs on this page. So if you scroll down, you'll see the county, and then the DRC that's associated with that county and their contact information. So you will see that some of them are listed as vacant. If there's a county close to you that does have somebody, I would reach out to that person or that local career center in your area. Things are changing all the time. They might have somebody identified for that position. Some areas are still getting up and running, but definitely still reach out to that career center regardless, to see what some of those resources are specific to your county, but we may connect you also with a bordering county as well for the DRC. So this was all the list of them. I always like to show people too, because it's not always intuitive sometimes. Let me see. Ooh, actually, maybe they fixed it. Sometimes you have to scroll between the two different sites, so maybe they fixed that. Good. All right, let me go back to these slides here. Okay. So I know Lisa talked a lot about getting connected with your local benefits advisor. Disability resource coordinators are all either currently certified as a benefits advisor or are in the process of becoming one. So we are that free resource through the career centers to provide this assistance. So we are out there trying to help people, do this in the best way and understand their options for employment. We're also working a lot with other programs in the area. We take referrals from other providers to provide that benefits assistance as well. So I wanted to highlight a couple of success stories from some folks that actually they were part of the Ticket to Work program and still are. But so an example of, well, let's start with one that she started out as part-time. She came in looking just for part-time work. She hadn't worked in many years, was dealing with some mental health diagnoses, and she came in not quite sure what she wanted to do or what she could do based off her skills, and also with finding part-time and not full-time. Sometimes those are trickier to find. Worked with our staff to update her resume, identify really, more of a targeted job search, which jobs she wanted to work towards. I was helping her as well with the benefits piece and what to expect when it came to her SSDI benefits. And she had the concern about losing Medicare as well. So provided that information that Lisa just went over. And she felt comfortable starting to take on part-time work. And she was working for a few years part-time and has just switched actually to full-time employment and is doing well. So throughout that whole time, if she got letters from Social Security because she was reporting her wages on a monthly basis, they'll send communication via mail, and sometimes they're not the easiest to read. So she would reach out to me whenever she got a letter, and we'd walk through it. And I'd reiterate, it's nothing to worry about. This is just what it's saying. It's informing you of what we've talked about. This is going according to plan with what the rules are for work incentives. And now she's full time, so she's starting to work her way through that extended period of eligibility and earning over SGA and being self-sufficient. So another person that I was working with, actually, same kind of situation as far as not working in quite some years. He had more of some physical disabilities, some medical conditions, and was at the point now he was thinking about, jumping back into work, and he wanted to get right back to full-time employment. So right off the bat, we were starting to talk about his SSDI and those work incentives, a trial work period right off the bat with him. So we helped him with identifying, an employer that could help with further certifications because he had a goal of becoming a pharmacy technician, and found an employer that was able to help him with that training and is now, in the process of becoming licensed for that. So it's worked out well for him. He had both Medicaid and Medicare, and we helped navigate that process and the Medicaid buy-in process, and still receiving that Medicare under extended Medicare coverage right now. So still in a good spot with that for all of his medical concerns. So these are just some examples, how we're there through the process. And, even if somebody might feel self-sufficient with the job search piece, they're at least still connecting with me for the benefits piece and ongoing support with that, especially through Ticket to Work. Okay, so we went over what Ticket to Work program is. I'll just say locally, and under the NICE system, what we do if somebody is interested in Ticket to Work locally here, you'd be connected to me for assigning with Rochester Works, and we would work together to develop a work plan. So identifying really what are your career goals and what kind of support you're looking for. Because this is going to serve as kind of like a contract between the individual, ourselves as the employment network, and Social Security. So, eventually working your way towards self-sufficiency and not relying on benefits anymore, but identifying what steps you need to take to get there and the support that you would like from us to get there. So we developed that plan together. It's really not that bad. A lot of people are coming from services where there's a long process for paperwork and multiple steps to get connected. This is actually a pretty streamlined process, so it's not that bad at all. So yeah, that's kind of all I have on my end. So I have my contact information on here. I'm also listed on that list that I showed you before on the website. So yeah, I know my piece is kind of short and sweet, but I would really encourage you to connect with the Career Center. I should mention that Career Centers, they're all free. All of our services, we are open to the public. Anybody can come in. Sometimes people think that we are only for people who are unemployed, but we serve people who are employed as well. So if you're even working somewhere and considering your next career step, get connected and see what supports might be available for you. And that's it.
Thank you very much, Lindsay. That was all very informative information from both you and Lisa. We have been answering questions, answering questions as they have come in. Some of them were answered live, some of them were answered within the chat. There are a couple left in the open area. While we're taking a look at that, thank you. If there are additional questions that you have, or yes, there's two more questions that we have in the account. So in the chat here. I'm gonna put up our feedback survey as a part of our presentation process. If you could take a moment to do the survey for the information that you received tonight. And as that's getting up, Lindsay, are you able to see the questions there? Lisa, I'm not
Yes.
sure if you're able to see them as well. If you could take them or answer them, sorry.
So I'm looking at the one about assisting with SSI process. So as far as applying for disability benefits, that's outside the DRC role. We're really focused on employment as the main goal. So when we're talking about benefits, it's in the lens of employment and these work incentives that Lisa went over today. So mainly we're working with folks that are already receiving those benefits.
Lindsay, since a lot of the employment support comes from Medicaid, do you have an idea of who could help in that role?
For applying for Medicaid?
Correct.
So typically, working with independent living centers across the state, I would probably, when speaking statewide here, independent living centers might be able to assist with that process of applying for multiple types of benefits, or your local Department of Social Services office.
Thank you.
For one of the comments, it says for individuals receiving SSDI, so they need to make under SGA, which is difficult with raising wages in New York State. And that is true. As the wages go up, it's difficult to stay underneath that SGA, but it's possible to be able to use IRWE expenses, if you have those, to be able to lower that, losing the benefit. Both for SSDI and SSI. Another question is, are you able to use an ABLE account if you were approved for OPWDD service, but not SSI? So the eligibility for an ABLE account is having a disability before the age of 26, having a blindness disability, SSI or SSDI, or the other alternative on that sheet, on that list, was that you have a diagnosis from a licensed physician. And so as long as the disability was prior to the age of 26, you ought to be able to open an ABLE account if you have that diagnosis from your doctor.
Thank you. We have a few more minutes if anyone else wanted to throw another question within the chat. We do plan to send out the slides and the recording this week as soon as it is available. I now have the slide up for your feedback matters. So please consider completing the short survey to assist with developing future presentations. We have the QR code here and also a link to the survey if that is preferred. See, another question popped in.
So the question is, my daughter receives SSI and gained enough work credits under the age of 24 to qualify for SSDI, but SSDI turned her down because she had worked too much. No one told us about the work activity questionnaire, but it was totally applicable. Can this be applied retroactively? Lindsay, I might defer to you for this. There could be a redetermination, correct?
I think this would be one you might have to work more one-on-one to get all the facts, but work activity questionnaire, the way I've seen that used, because I'm only working with folks that have been approved for benefits, that's typically to get that information just updated with Social Security about the work record and any of those work incentives or subsidies or anything that Lisa was talking about to make sure they were applied as it pertained to their benefits. I'm not sure on its relation to somebody who has not been approved for SSDI. So that might be a question directly to ask Social Security. It's always hard with benefits questions, and when we do these presentations, we try to give as much as we can, but um, like I mentioned, I do that increase your income one, monthly, and we give as much as we can. At least this is giving you the lingo, to speak with Social Security when you do have these conversations with them. But a lot of times we really have to sit down one-on-one and kind of get a lot of the backstory from somebody's situation to really understand what's going on with their case, and even, request some information from Social Security to verify information. So it's hard to give like one-off answers. I know that's not helpful, but it's the nature of it.
Yeah, there's so many nuances to an individual's personal situation that we don't know everything about it at this level. Anyway, yeah.
All right. Ladies, you are very efficient. Okay, I see another question. I'm like, bring in the questions, folks. So, if you earn money working with Access VR in high school, does it work against you when you apply for Social Security income?
I don't know if Lisa, you have thoughts, but again, I'm not on the side of applying for SSI, so um, I'm not quite sure if I could answer that.
Um, in high school. So one of the things that happens that we didn't talk about for benefits is that I guess when you apply for SSI, so it's a different scenario. But if you are receiving SSI benefits in high school and you're transitioning at the age of 18, there is it's called Section 301, which allows you to still maintain your SSI benefits if you're involved in one of the employment programs, like with Access VR or an educational program or Ticket to Work. So this question is a little bit different. If you earn money working with Access VR, so I assume in a job that maybe they've set up for you, like a work shadow or a work placement, I don't think that that would work against you when you apply for SSI, because what SSI is looking for is low income and low resources. So as long as that applies for you, I don't think that that would have any determination whether or not you're eligible for SSI. So it kind of depends again on your specific scenario, how much money you earned, how many hours you were working, if that's still happening. So anyway, a lot of different variables. If you want to talk more about that, you can certainly reach out to one of us. We were applying because we had a disability. So, and this is related to the previous question, right? The high school
I think so.
VR. Okay. So so I don't know if the person would be over finished with high school and over 18, that might make a difference, or if they're still considered child with a disability. Social Security has two different definitions of disability. So there's an adult definition and a child definition. And if you are under the age of 18, you would fall under the child definition of disability with Social Security. And if you're identified as having a disability, you could apply for SSI benefits, and your doctor would provide the diagnostic information to Social Security to prove that disability. If then you turn 18 and you're applying for disability SSI at that point, there's an adult definition. And so that just matters from an adult perspective. And part of the adult definition is SGA level. So if you are 18 years old or older and you're applying for disability benefits, one of the answers to that would be being you're not able to earn substantial gainful activity, which is that 1610 this year. So it kind of depends. So again, if you want to talk more about it, please let us know. We'd be happy to delve into that a little bit deeper.
And I'll comment on the other question that came in about finding a benefits advisor in New York City. New York City, as Lisa had mentioned earlier, we do now have disability resource coordinators covering New York City area. So it's my understanding that they are benefits advisors or in the process of becoming benefits advisors. So
they're all certified now.
Okay, good. Yeah. So reaching out to DRCs from that list provided earlier will help connect.
Lindsay, can you copy and paste that in the chat, the contacts?
I'll put it in, so the answer for the Q&A, because I know the chat.
Yes, that's what I mean, thanks.
Okay.
So
Right.
are the New York folks, I'm sorry, are the New York folks added to that link, Lindsay?
Yes, they're on there.
Okay, perfect, thanks.
So you'll be looking for, and they're going to be listed a couple different times on there. So Maricela Brea, Elda Solano, and Carlos Leon.
Lindsay, can you also just talk about briefly if as another option going through Access VR or using Ticket to Work as a way to access benefit planning?
Yeah, so Access VR, and if people aren't familiar with Access VR, so it's the state, employment service to provide individuals with disabilities assistance with employment or career training. So what they do is, and then I can speak locally here, they have their main office, and what they do is work with local agencies to provide a lot of their services. So it's kind of like the hub. You open a case with them, and they will connect with agencies to provide any area of service, whether it's career exploration, supported employment, variety of things. One of the services they can refer out for is benefits advisement. So there's local providers in the area that have a contract with Access VR to provide that service. So you can always go through them and mention that you need benefits advisement. They'll connect you for free to one of their vendors. And Ticket to Work, like Lisa had mentioned earlier, not every Ticket to Work provider has a benefits advisor, but majority do, I would say, and especially locally here, we would do that. And in New York City, those three DRCs I mentioned earlier.
Thanks, Lindsay.
I dropped the Access VR link directly to the Manhattan district office for Access VR. But of course, Access VR is a state agency that has district offices across the entire state. Right.
And I guess could I mention or add to that, Access VR, it's called Access VR here in New York, but VR, vocational rehab, is a state and federally funded program. So any state that you go to would have a vocational rehab program. So if you're not in New York next year, you could always look up Access or a VR office wherever you are, in whichever state you are in.
Thank you. Great point. Because we don't know who's going to watch on the replay. But it's definitely great information all the way around. We were scheduled to go to 8:30, but we have done very well. We have another question coming in. Yeah, so if we don't have any more questions by 8, we might wrap up a little early. But here we go. Assume we can only access benefit advisement support through Access VR New York City. If we're using Access, no, we are OPWDD. Okay.
So the DRCs, again, can assist to anybody that's coming through the career centers. So it does not have to be through Access VR. It's just another way that if you are working with Access, they do have providers through them as well.
This is down in New York City though, so it would be the what are they called? The managers?
Program managers, yes.
And a question about assistance with self-employment. So self-employment, I believe Lisa is something that Ticket to Work can assist with as well. So finding a Ticket to Work provider to assist with that. But career centers do, it varies across state what kind of supports, but we're at least connected to the resources in our each area that help with self-employment, small business centers. So, we have workshops on self-employment here at Rochester Works. So really depends where you are. Again, just getting connected with that career center will help point you in the direction of locally who could provide that assistance.
I'm gonna look up a couple links and I'll drop them in chat.
Another thing that I didn't mention, I don't think we mentioned this tonight, but if you are currently receiving SSI and or SSDI benefits, one of the things that the Ticket to Work website, which is at choosework.ssa.gov, they offer a monthly WISE webinar, and that is a no-cost information training that happens monthly for about an hour and a half. They talk about how benefits will be impacted when you go to work. And then the second half of that is a specific topic. And the last one that I attended, it was about self-employment. And so it was how Ticket to Work can work with self-employment. So just something for you to look at if you're interested. I would go to the Choose Work website and select WISE webinars and then register for them, and they're free. They're really designed for individuals who are the SSA beneficiary, the person receiving the benefit, but anybody can attend them. So if you want to go with a family member or the representative payee or a staff person at your employment network, absolutely sign in and register for those webinars on a monthly basis. So this question, it says we're transitioning from one area of New York State to another. What do we need to know to preserve the Ticket to Work? haven't worked in several months, and the employment services agency with the ticket to work is in the old region. We don't yet have a provider in our new area. So that's a really good question. Some employment providers can do the entire state. Some of them do nationwide coverage. So you don't necessarily have to change providers if you don't want to. If that provider can help you being then the old area of the state, then that could be fine. But in your new area, if you want to find an employment provider, you could go to the Choose Work website that I just mentioned, choosework.ssa.gov, and there is a Find Help tool. Yeah, find help. And then you could just put in your new zip code in that area and you could find an employment provider within your new area. So what will happen with Ticket to Work is you'll have to unassign the ticket with the old provider and reassign it with the new provider. Because you can't be assigned to two at the same time. But again, I would find out if you still enjoyed working with the old provider and they can still help you because maybe they're statewide, then that would be completely fine. Or you can find a new provider within your new area. And we do have a locator map located on our website. If you would like to connect with me, I can help you find somebody in your new area. Long wait lists for services and agencies in the new area.
I would
Unfortunately,
say,
that's a very real thing.
but I
Yeah,
would say get connected with the DRC in that new area.
there you go.
There's one covering that because they can help you navigate what's available.
Yes, good point.
Great questions coming in so far. Thank you everyone for participating. Um, those answers will be sent out. We have another one coming in. How does this coordinate with care management CCOs? Who wants to take that one?
Well, what do you mean by how does this? Like the benefits that we've been going over or
Thank
anything
you.
specific?
I can start to answer as far as the DRC connection with care management. So we are, and yes, if it's employment services, we're bringing them into the picture with all any other supports the person might have. So care management has kind of like the role that they're playing. The Career Center might serve another role. Maybe they're connected with Access VR to serve that role. So again, it's kind of making it clear to the individual who they would go to for what, and getting everybody on the same page. So there definitely could be coordination with care management. It's not going to take the place of it, but would work in conjunction.
Absolutely. Thank you for the questions. And with that, we'll wait to see if anyone else comes in. Absolutely. That's a great way to end our presentation today. A copy of this webinar recording, as well as the informational slides, will be sent out to everyone who is